हेलो नमस्ते ऑल। अपने ग्रुप में ना एक क्वेरी आई थी कि फैटी लीवर के लिए अगर पेशेंट रिपोर्ट लेकर आता है तो प्रॉबेबली क्या मेडिसिन देनी चाहिए। तो मैं टॉपिक को डिटेल में आज डिस्कस करता हूँ। तो फैटी लीवर ना 3 ग्रेड में होता है, ग्रेड 1, ग्रेड 2 एंड ग्रेड 3। तो ग्रेड 1 हम तब बोलेंगे जब 5 to 33% ऑफ liver is occupied by the fat. Then if there is more than 34 to 66% of fat in liver, then it is grade 2, and if more than 66% then it is grade 3. So usually grade 3 is irreversible changes of the liver as per modern medicine. So what are the predisposing factors for fatty liver? So first one is obesity, then alcohol consumption, but how much the quantity of alcohol consumption, you cannot think this as a predisposing factor in cases who are drinking occasionally, but who are drinking 40 to 80 grams of daily alcohol for more than 10 to 12 years. Then diabetes mellitus, old age, hyperlipidemia, hypertension, then hypothyroidism, then PCOD, the most important predisposing factor. Then pre-existing illnesses of liver like hepatitis C, then family history of liver disease. Then these are the most common predisposing factors to have fatty liver. Then what should be the management? Management consists of two types. One is the lifestyle modification and second is support of medicines. So in lifestyle modification, patient needs to avoid sugar if he is obese or he is of the habit who is eating outside. Then saturated fats and processed food should be avoided by the patient. Then correction of underlying factors as needed, as we discuss in predisposing factors, like patient should do exercise. Then if he is alcoholic or he is taking occasionally alcohol though, but he is obese or diabetic, then he should stop consuming alcohol. Then he should consume balanced diet. Then control of diabetes mellitus and serum insulin levels. So next is there are two types of what we can say fatty liver disease or this thing. So one is non-alcoholic fatty liver, then second is alcoholic fatty liver. So in non-alcoholic fatty liver, obesity and diabetes mellitus are the usual associated factors. Next, symptoms what we will get. So in grade 1 and grade 2, what happens, patient goes for ultrasound sonography for some ailment other than that of liver, and accidental finding of fatty liver is there on report, and patient comes to you and visits your clinic and shows you that whether do you have some medications to get treated for this. Many a times grade 1 and grade 2 are asymptomatic, but still if the patient but some patients have the symptoms like fatigue, fullness and bloating of abdomen during grade 1 and grade 2. Then grade 3. So grade 3 we have the two types, one is alcoholic and one is non-alcoholic. So what will happen in non-alcoholic, the patient will present with increased fatigue, increased bloating or discomfort in abdomen, abdominal pain and unexplained weight loss in non-alcoholic fatty liver disease of grade 3. Then grade 3, alcoholic patients, they may present to you with fibrosis and cirrhosis. These are the serious cases which will present to you with ascites, easy bleeding, itching, ecchymosis, and in severe cases they may go to confusion, muscle wasting and recurrent infections. So this is grade 3 alcoholic liver disease. Then now we will come to the main point, that is therapeutics of fatty liver or liver cirrhosis or liver disease in homeopathy. So we have many remedies. The basic selection of the remedy always lies with constitutional remedy, but if you won't find any constitutional remedy with the patient, or you want to have some group of medicines through which you can reach easily to the constitutional remedy, I am going to describe few of the remedies which I usually use in my practice along with the indicated potencies. So the first remedy will discuss about Culus. So Culus will have alcoholic liver disease in background. So how the patient became alcoholic, if you go into the history, then you will find that suppress anger, suppress grief, or for the from disappointment, he may have started drinking alcohol, and whenever he drinks more alcohol, then he will have the character of he will sing, he will quarrel when he will take alcohol. So this will you get in mental picture of Culus, and then ailments from. So what will be the symptoms he will present with? So confusion he will have during acute alcoholism, means when he consumes more quantity of alcohol and he gets intoxicated with that, then he may go in confusion. This will be the next stage. After what we discussed about singing, quarreling, after that. And Culus usually prefers alcoholic beverage like beer. Then what will be the symptoms on physical plane? Then he will have bloated abdomen, but the bloated abdomen, he will get heaviness or bloated abdomen, but it will get aggravated when he walks or he jars. So stepping will aggravate for Culus patients. Then he will have pain in epigastrium over here, and then this epigastric pain will always associated with palpitations. Hepatic region of this patient is usually painful, but this pain usually gets aggravated when he steps or after the anger, fit of anger. So this is the first remedy. So you can get in totality, whatever totality, if you find this one, you can go with Culus. So potency, you need to give 30C, then 200C, a month apart or 15 days apart, and you can repeat the ultrasound after 2 or 3 months period. Then the most important remedy next is ammonium mure. So what you will see in ammonium mure cases, I have seen one case where the obesity was there around the trunk only, and his legs was very thin, but the keynote of ammonium mure is all the complaints or abdominal complaints are get aggravated in afternoon. So this is the indication to prescribe ammonium mure in cases of fatty liver. So you can give this in grade 1 and grade 2. Then the most celebrated and important remedy to go with is Lycopodium. So as you know that he is intellectually keen and physically weak fellow. So it is indicated in cases of alcoholic liver disease with diabetes mellitus. You will always find the more predominant of right lobe of liver for that fatty liver reports in sonography. So right lobe is markedly involved. Then this patient will have history of tobacco chewing or smoking along with alcohol. In alcohol he will prefer wine, or you can say whiskey or rum, like that. Then whenever you ask the patient of Lycopodium, he usually when he needs to have his food, lunch or dinner or breakfast, he will always loosen the cloth around waist. He cannot take his food without that thing. Then indigestion will be there. Then 4 to 8 pm aggravation, what we know is marked in Lycopodium cases. Then the aggravations of his abdominal complaints in usual cases you will see after flatulent food, cabbage, beans. He will have aversion to soup or bread. He will get aggravated if he is not getting his meal on time. Then he will get aggravated. So missing meal gets aggravated. He is better by uncovering. Then on mental plane he is apprehensive, lack of confidence. Then excessive hunger is there, but thoda bhi kha lega to he will have fullness of abdomen. So if you are getting such a symptoms, you can think of Lycopodium. I will add more things which are important to prescribe Lycopodium are they are craving for they crave sweets always. Then they have aversion to bread, and if we see the flatulence, it will be especially in lower abdomen. Then they will try to pass out it, and the flatulence will be noisy but not the offensive and noisy you can see in sulfur cases. Then you may get kidney stone in these cases in current sonography reports or in prior history of those patients. So these patients also have a hunger at night time. They will wake up and they will try to find something to eat. You may get this thing. And one more important thing I have noted, or it's written in Matramedica, and you see that if you ask the patient whether he prefers to have a warm food or मतलब गरम गरम खाना जब बीवी बना रही तो तब खाएगा, मेल रहेगा तो, या फिर खाना वो कुछ देर बाद खाता है टिफ़िन में लेके जाके, तो टिफ़िन में ठंडा किया हुआ खाना उसको पसंद है अगर टिफ़िन लेकर जाता है, या फिर वो अपना पेट भर के आराम से खाएगा जब वो घर पे रहेगा तब गरम गरम खाना मिलेगा. So Lyco prefers warm food always. So if you are getting this thing in background, along with history of chronic hepatitis, on and off he is getting the jaundice, then you can think of Lycopodium in such a cases. So I will advise you to judiciously use Lycopodium. You have to start from lower potency like 30. Do not repeat the Lycopodium very frequently. Many of the Matramedica suggest us not to start the cases with Lycopodium. But if you are getting in totality, then you can surely start, but don't repeat it very frequently unless and until it is needed. Then the next most important remedy which has its action on liver, marked action on liver, is phosphorus. So phosphorus patients you will get, they are chronic alcoholic, then family history of liver disease or infantile jaundice in the patient, or there will be family history of jaundice or liver disease for sure you will get. Then the desire for ice cold drink or ice cold ice creams or ice cold things will be always there. Along with liver complaint, there will be arteriosclerosis in this patient. Then they may have ischemic heart disease or coronary artery disease. Then great weakness and prostration with nervous debility. This phosphorus patient always comfortable or try to sleep on right side. Then tubercular diathesis will be run through and through their life. You can have that, so you don't expect this patient will be obese, but they will be lean and thin patients. Along with that, burning will be there, diabetes mellitus will be there, and hypertension also associated with this. I will give you a tip over here that if any of the patient does not necessary that he should be constitutionally phosphorus, but if any of the patient is going for any type of surgery, consider it is major or minor as like of tooth extraction, then give a dose or a 2 dose of phosphorus 1 m 1 hour before or half an hour before the surgery. It will prevent the complications of anesthesia, and it will also prevent the excessive bleeding which usually happens after many operations. So this is the clinical tip. Apart from this thing, you may know that before also. Then postoperative vomiting and prolonged anesthesia means we see that some patients won't get out of anesthesia, so it is also prevented after that dose if we give preoperatively. Abdominal pain of these phosphorus patients is always relieved by ice cold drink or ice cream. Burning in stomach is aggravated by eating. They crave for salt as like our natrum more salt and spicy things. Then you will see I have seen some cases, if they are in your waiting room, you can observe that the patients will always they will try to rub this area unknowingly, so they feel better. So this is magnetism, what we can say in phosphorus cases. So abdominal pain is relieved by rubbing. It's also one of the keynote for abdominal. Then there is one thing written in Matramedica as like nutmeg liver under phosphorus. So what is nutmeg liver? So it is diffuse venous congestion in liver due to right heart failure, means right side of the heart, right atrium or right ventricular failure or biventricular failure. So you can always think of this remedy in such cases. It is usually due to tricuspid regurgitation or mitral stenosis or cor pulmonale. So the disease lies in heart, but the complaints and symptoms we will get in liver. Then as you know, the phosphorus is chilly patient. Then abdomen is sensitive to touch, but it is relieved by rubbing. So these are the all in all indications of phosphorus. uh, there are two more polycrest important remedies that you can read and apply according to their constitution. One is arsenic and second is sulfur. So we have completed up till now the six remedies of therapeutics. Now I will consider the two more remedies which I am using when you are not getting such a types of totality in your cases. The next remedy is Allium sativum, that is the garlic in our kitchen, Indian kitchens we found. So Dr. N.M. Chaudhary in his Materia Medica uses a word high liver patients. So what is this high liver patients? So the patients who live in luxury, they are living their luxury life. So you can consider prescribing Allium sativum as a constitutional remedy in cases of fatty liver. When you see this along with the symptoms as like below, I will describe. So the patients will suffer from indigestion due to their limitless appetite for food and drink, what we called as a gluttony. There is a rubric in Fatakals gluttony. So they will eat beyond their capacity, they will drink beyond their capacity. So these patients have limitless appetite. Then they are prone to suffer from gastric trouble like burning, dyspepsia, distension, then heartburn, then pain in abdomen, then belching, just after the slight change in their usual manner of living. So if they move a slight apart from their routine living lifestyle, then they will suffer from these gastric troubles. If you get these things in background, then this is you can have a constitution prescribing. It's not like we are using it therapeutically, but you should see in each and every case what your case actually demands. So the potency here you will prescribe is Allium sativum in 6C, say TDS or BD for months together, and repeat ultrasound. I usually repeat the ultrasound after 3 months. Then the next most important remedy I usually use when I didn't get anything from the patients. So you can get the next remedy will be Vanadium. So Vanadium I use in same potency 60 TDS for 8 to 10 weeks, repeat USG. So what you will get in Vanadium, it's actually what we can say oxygen carrier medicines of our Materia Medica. So patient will have depression or feeling of guilt due to failure. So if you dig into the history and you find this thing, then you can confirm with this remedy. Then you see a face is deeply pigmented over here or over here. You usually see in chronic ailments like diabetes or ischemic heart disease, or some patients who are going on medicines. You get such a dark pigmentation over forehead or over face, anywhere on the face. There are some patches like that. So you can get that thing from that. These patients are usually associated with coronary artery disease, as I already spoke, and then hypertension, atherosclerosis, and low HB always. So Vanadium is a known remedy for such a thing. And these are non-obese patients. They are having tubercular diathesis in background, and they are having profound weakness in spite of having means they are having profound weakness. So this is all from my side. Apart from this, there are many remedies in our Materia Medica which can be used, but I will advise these remedies to be used by only doctors judiciously after finalizing the constitution. If they are not getting constitution, then and then they can think of these therapeutic remedies. Otherwise, they can continue with whatever their patient goes with. I have tried my level best to talk about this topic, which is really challenging in our OPDs and clinics. Many times I also get the failure, but if you have some remedies in hand which can be used very frequently, then it is always useful when you don't have any symptoms with the patient and he is just coming and showing you the reports. So thank you all. Please do subscribe my channel, share, like and comment below the video how would you like this, and let me know on what topic you want me to prepare next video in the comment section below. थैंक यू ऑल।